Thank you very much. Chairperson of Officiates Fiji, Dr. Rob, Acting Medical Superintendent, I'm sure Dr. Fong is not here, our Acting Medical Superintendent from Ludoga Hospital, Dr. Taito, WOW's representatives, senior government officials, sponsors, Sports World Courts, and Dave, I can't forget you, so thank you very much for all that you do. Our non-governmental organization representatives, our media partners, children, parents, Nisambula Vinaka, and a very good morning to you all. Before I begin, because Dr. Tukana has mentioned the two ministries, I was fascinated to work in Ministry of Women and Children, but I'm frustrated to work in Ministry of Health and Medical Services. So it's a combination of both that makes my life very challenging in this role. But at the offset, please allow me to thank you all for being here this morning for this very important launch in this month of August. And your presence here indeed shows the commitment that you have towards working for the betterment of our children. I mean, not only children who would be going through this, should I say cancerous disease, or should I say deadly disease, but for the fact that all children are important to us. As mothers, as caretakers, as grandmothers, children hold a very special place in our heart, and I think we all need to do everything that is within our reach and within our powers to make sure that our children get the best. And our gathering here today is basically to create an awareness about what we as stakeholders, what parents need to do, what stakeholders need to do, what our corporate partners need to do to make this a talking thing amongst families. Okay, it's very important that we talk about it because, like mentioned, the pain, whether you go as an adult or a child or an elderly person, is still the same. And we all need to share. We need to share in the pain. And of course, another reason for us to celebrate is because it is something that we can tackle. So thank you all for being here this morning. So ladies and gentlemen, cancer continues to be the third most common cause of death in Fiji, here in Fiji. Statistics reveal that women are more likely to be affected by breast, cervical, uterus, ovary, and rectum cancer, while in men, we find cancers such as prostate, liver, rectum, and lung. So according to WHO, the term childhood cancer is most commonly used to designate cancer that arises in children before the age of 18 years. Some of us might consider 18 years to be adult, but they're still children. Okay? So the overall incidence rates of childhood cancer vary between 50 and 200 per million children across the world. And of course, cancer is the second leading cause of death globally, with 8.2 million cancer-related deaths worldwide registered in 2012. Furthermore, the annual number of new cases is projected to rise from 14.1 million in 2012 to 21.6 million in 2030. So of course, very alarming and something that should be of concern to us. In addition, if we look at the economic impacts of cancer, of course, it's very significant as well. In 2010, the total annual economic cost of cancer was estimated at approximately US $1.16 trillion, threatening economies at all income levels, as well as causing financial catastrophe for individuals and families. It is estimated that 45 new cases of cancer in children under 15 years are diagnosed every year in Fiji, but less than 50% are presenting to the healthcare systems pretty late. So awareness campaigns such as this are very important on early recognition and presentation, which is of utmost importance. Ladies and gentlemen, I'm pleased to say that in the last 5 years, the survival of common childhood cancers in Fiji has more than doubled, which is good. This continues to improve with ongoing training and continued support from long-term bilateral commitments with the New Zealand National Child Cancer Network, along with the tremendous work carried out by our own institutions like WOW's Kids and that of the hardworking doctors, nurses at our health facilities. Having said that, I am optimistic to say that many cancers are treatable, provided they are diagnosed early and followed by proper care and treatment. As such, as a ministry, we remain committed towards the reduction of cancer mortality, improving the survival rates of cancer cases, and improving the quality of life for cancer victims. In doing so, the Family Health Unit of the Ministry of Health and Medical Services, in partnership with WOW's Kids Fiji, Fiji Cancer Society, the National Paediatric Oncology Committee, is proud to launch the Childhood Cancer Awareness Month today. We have dedicated the month of August, next month, as a means to intensify our awareness and increase our reach out to raise public awareness and disseminate information in supporting our little chimps and fight against childhood cancer in Fiji. Just as a way of background, the key objectives of the Childhood Cancer Awareness Month, of course, one is to raise awareness of the incidence of childhood cancers in Fiji. Secondly, it's also to raise awareness on the ways to detect early signs of childhood cancer in Fiji, hence promoting earlier detection and decreasing the occurrence of late presentations at our hospitals. And of course, thirdly, it is to remove the stigma that is sometimes attached to cancer, and in this case, childhood cancer, thereby rallying the support of all our Fijian people for our little champs as they and their families battle against cancer. The launching of the National Paediatric Oncology Policy, again, is a milestone achievement for our dedicated and professional medical team at the Paediatric Oncology Unit here at CWM. The successful drafting of this policy is a reflection of the unprecedented commitment and passion to enhance, streamline the development of pediatric oncology services in Fiji. So I thank you all for that. Ladies and gentlemen, the policy is the national plan for the care and support for our children with cancer. It is to ensure that there is timely provision and equitable access to pediatric services, leading to improved overall survival and better quality of life for our children and adolescents with cancers and with their families. We also need to continue the current progress of child cancer in Fiji, because there is an urgent need to support local leadership through inclusion of child cancer in national policies and strategic health plans. This is the first time for such a policy to be introduced, and indeed a consolidated policy of this kind will foster efficiency and assist the team to take pediatric oncology services to another greater level. It will also empower our medical professionals who work within this unit by equipping them with information and knowledge to carry out their roles more confidently and diligently. So I'd like to congratulate Dr. Miriana Tukana, the head of the unit, and her team, who have put in their valuable time and strength in developing this new policy. And of course, I take great pride in wishing you the very best and thanking you and your team for your hard work and commitment. The ministry stands ready to support you all the way in supporting plans and policies such as the one you have initiated today. On that note, allow me to put on record my utmost appreciation to WOW Kids Fiji for its wonderful partnership and years of perseverance and hard work in reaching out to thousands of children and thousands of families who need support at the most challenging time of their lives when they are trying to survive life-threatening diseases like cancer. WOW Kids Fiji continues to inspire the world by cultivating the message of hope and unconditional love and compassion, because there's always an opportunity to restore life, restore hope, and health for those that are challenged with ill health. You are the champions, WOW Kids, and your generosity and kindness will inspire our little children and their families to live their life to the fullest and mold them in becoming great leaders for our nation. So on behalf of the Minister and on behalf of the Government of Fiji, I thank you for your great work and enthusiasm. As a ministry, we are truly proud of your achievement and our partnerships, and wishing you the very, very best for your future plans. To all our other partners, please also allow me to thank you, and to all the other NGOs that work with the Ministry of Health in supporting this cause. To the parents, to the children, I'm sure it's not easy, as mentioned earlier on, but we've got to work strong. We've got to fight on, and that's the message. Okay, regardless of what we suffer from, we need to provide that support to our children, our families, our patients, that life has to go on. There are a lot of challenges in life. Nobody said life was going to be easy. And unfortunately, there are times when you need support. So I'm glad that we have our partners and stakeholders who are always there to provide you with the moral support, with the financial support. And the ministry is very proud to be associated with all our partners. And ladies and gentlemen, while we have the support mechanisms in place, I'd also like to elaborate that when it comes to cancer prevention, not only in childhood cancer, but cancer as a disease in general, the onus is also on each and every one of us to be health conscious. We need to take ownership of our health. We need to get screened for cancer and other general health issues. And we will be in a better position to be aware of our health status and the way forward. The knowledge that we gain in turn will enable us to seek treatment if we are ill, or continue to live healthy if we are well. Friends and colleagues, if we can detect cancer early, then we can treat cancer early as well. Early detection is the best prevention, and like I said, cancer can be treatable if we detect it early, and that can only be achieved through screenings. And through the Childhood Cancer Awareness Month, starting next month, this is the key message which we would like to aim to drive out to families, communities, organizations, and individuals as a whole. And I understand that WOW Kids Fiji and the ministry has a lot of activities planned out for the month to push out this message, to visit as many communities as possible, and to capitalize on our media partners to disseminate information and seek your support for this initiative. Media plays a very important role. So to the media partners present here, I thank you for partnering with the Ministry of Health in disseminating information, important and vital information to our public, and I look forward for your continued support in the month of August to ensure that we reach out to homes and communities and families with the message of early presentation to our health centers. Of course, this month will also be an opportunity for us to establish social support for patients and cancer to address the fears in survivors, which can be addressed through support networks and even with readily available information. So I'd like to encourage all the public out there to make maximum use of the awareness and outreach programs, public forums that will be organized to hype up the awareness on childhood cancer. It is also very important, it is also an opportunity for our business communities, our corporate stakeholders, to reach out and make a positive difference in the lives of the families and children who have been devastated with the impacts of cancer. It is not only the battle, ladies and gentlemen, it's our battle as a whole, and together we must work to find a way to win against this battle. So with these words, I wish you well in the future deliberations, and I know when we work together, we have the powers to make a difference, and I'm sure we will all provide us much needed support in this very, very worthy initiatives. And may we all work towards this cause to make a difference in the lives of our children. And when we make a life in the difference of our children, we make a life in the difference of our families as well. So it's all a collective effort. So I thank you for being here. God bless you all, and thank you very much.